everyone, this is Dr. Abinaya Vijayakumar. I'm a doctor and a post-pregnancy coach. So today in this live, I'm going to talk all about placenta previa or low-lying placenta. So all of us know that placenta is a structure which gives nutrition towards the baby. Okay, starting from third month. Okay, first 3 months the placenta starts developing and getting formed, and after 3 months, placenta starts its function to provide nutrition to the baby. So, what is the natural position of placenta? Placenta is naturally situated either in the in the fundal region, that is the upper segment of the uterus. It would be either anterior, that is front, or posterior, back, or lateral on the sides. So mostly it would be in the fundal region, which is the upper part of the uterus. But sometimes there can be placenta which is formed in the lower segment of the uterus. So initially by 12 weeks when you do a NT scan, you can be you can be told by your doctor that you have a low lying placenta. So low lying placenta basically means placenta is formed, instead of forming in the upper part of the uterus, it is formed in the lower segment. So now your doctor will advise something like avoid traveling, avoid sexual intercourse, avoid lifting any heavy weights, and to take adequate rest. Naturally by 20 weeks it has to come up. Okay, most of the time it will come up when it is 12 weeks. If you have a low lying placenta, by 20 weeks when you do an anomaly scan, there are high chances that the placenta moves up on its own as the uterus expands, and it can come into a fundal position, either anterior, posterior, or lateral. Okay, but if it is consistently present in the lower segment even after 20 weeks of gestation, that is 20 weeks of pregnancy, that is called placenta previa. So before 20 weeks we say it as low lying placenta, and after 20 weeks we say it is placenta previa. Now why are we worried about placental position? First, when it is a low lying placenta or placenta previa, there are chances of bleeding. Okay, so anytime when you have a bleeding or spotting PV and your recent scan shows low lying placenta, you have to immediately rush to your gynecologist to have to be to have a general check done. Why is this done? Because placenta previa has a natural tendency of bleeding sometimes. Sometimes this can lead to abruptia placenta as well. So this is one thing that we are worried about. Any bleeding during pregnancy, in case of placenta previa, you have to immediately visit your doctor. Okay. Second thing, if the placenta is persistently present in the lower segment of the uterus, that is even in 28 weeks, 32 weeks, the placenta is still low lying and there are no chances that it has to go up, it will go up after this. Okay, by from 12 to 20 there is a chance, but after 20 or 28 weeks the chances are very low because the placenta is already formed and it starts providing nutrition. There are no chances that it is going to move up further a bit. Okay, so when there is persistently low lying placenta excuse me, so when there is a persistent low lying placenta, during delivery, instead of when the cervix or the mouth of the uterus opens up, instead of baby coming down, the placenta can move a bit down and it can obstruct the path of the baby coming out. So this can lead to problems in natural delivery, because of which you may be taken up for C-section. So again, there are grades of placenta: grade 1, grade 2, grade 3, and grade 4. Grade 4 is the complete placenta previa, where it is completely in the lower segment, covering the mouth of the uterus. Okay, grade 1, grade 2, it is present in the lower segment but at least like 2 centimeter, 3 centimeter away from the mouth of the uterus. So in such scenarios we have to wait and watch during natural labor if the placenta moves up, moves down, and further obstructs the path of the baby's passage. Okay, so that is one thing that your physician is worried about. If you have a previous C-section, okay, here we are not worried about repeat normal delivery because it's going to be a repeat LSCS. So here we are not worried about it's obstructing the natural labor. But anytime during the pregnancy, if there are any chances of any episodes of bleeding or spotting, you have to immediately rush to the hospital. Okay. So these are the main things that you have to know about placenta previa. So during placenta previa, that is low lying placenta or placenta previa, avoid sexual intercourse, avoid traveling, avoid lifting any heavy weights, take adequate rest. If you are in somewhere between 12 to 20 weeks, wait for a bit, by 20 weeks there is a high chance that placenta can naturally move up on its own. Even after 28 weeks you have a, placenta previa or low lying placenta, then your doctor will follow you up in every upcoming scan, and then in the ninth month scan how is the position of placenta, that will decide whether you can go for a trial of normal labor or you have to go for a c-section. Okay, so that is about the placenta. Is there any medications or is there any treatment to move up the placenta? Definitely no. Placenta is something that is formed on its own, and the position also has to be moved up on its own. In early weeks of pregnancy, the uterus is still expanding, so there is a good chance that placenta can move up on its own. But there is no medication or no treatment to change the position of placenta. Okay, and we just have to follow it up, and we have to deal with any problem that is coming up due to the low lying placenta or placenta previa. Okay, so this is about the low lying placenta. So as I told you earlier, if it is before 20 weeks of pregnancy, in any scan, if it is the placenta in the lower segment, that is called low lying placenta. Both are the same, but the weeks of gestation differs. When it is after 20 weeks of pregnancy, that is called placenta previa. Okay, that is nothing, it's not a Greek and Latin term, it's just two different terms for the same thing. Okay, before 20 weeks it's called low lying placenta, after 20 weeks it's called placenta previa. Is there any doubt regarding this topic, regarding this placenta position? So that you can ask me the doubts in the comment section, so that I can clarify. So all this is very important when you are conceiving or when you do any scan during your pregnancy, because any medical terms can create a panic in pregnant women. So know the medical terms which is commonly used. That will give you more awareness and more confidence. Okay, a confident pregnancy is very very important for a positive birth experience. Okay, so this is all about placenta, and placenta is very important because it provides all the nutrition towards the baby starting from 4th month, and there is grades of maturity as well. So the placenta has to mature in different stages of pregnancy according to the gestational age. If the maturity is low, that is also a problem, that whether the nutrition is not getting, it's not going enough. And we also have to see how is the blood supply to the uterus and to the placenta. That is also measured, the resistance or pressure, that is also measured in each scan. So this is all about low lying placenta and placenta previa. Hope this helps. Do comment below if you have any doubt regarding this topic, so that I can clarify in the upcoming lives. Thank you so much. Thank you for joining. Good evening. Good evening. So thank you so much. Do let me know if you have any doubts so that I can clarify, or we can call it a close.